Let me ask you something. When you've dealt with back pain or joint injury in the past, when did you stop treatment? If you're like most people, the answer is when the pain went away. And I completely understand that. Pain is miserable. When it stops, it feels like a victory. You feel like yourself again, and you go back to your normal life. However, there's a problem. Pain doesn't mean healed. Let that sink in for a second. And stopping your recovery the moment you feel better is one of the most common reasons people end up right back in my clinic, sometimes with a worse injury than the first time. I'm Dr. Robert Moss, owner of Moss Rehabilitation Center in Springtown, Texas, and this is part 2 of our series of the magical 5 phases of healing. In part 1, we covered how to get out of pain, phases 1 and 2. Today, we're going to talk about what happens when the pain is gone and why that's actually where the most important work actually begins. So here's a quick recap. Phase 1 is all about getting out of pain and reducing inflammation. Phase 2 is about starting to restore your mobility, your flexibility, strength, and balance. The problem is, a lot of people experience some pain relief during phases 1 and 2, and they assume they're done. But here's what's really happening beneath the surface. When you're injured, your body is smart, almost too smart, and it starts to find workarounds. We call them substitutions. So it shifts your weight, changes how you walk. It avoids certain movement patterns. These compensations, substitutions, they reduce your pain in the short term. However, over time, those altered movement patterns become your new normal. So your muscles, they start to weaken, your range of motion starts to shrink, and you don't even notice it because your body is so smart and so good at hiding it. Until one day you bend over to pick up something or you twist the wrong way, and suddenly you're back where you started. That's not bad luck, that's predictable. And guess what? It's preventable. Phase 3 is where we start to get your real life back. And I want to be specific about what that means because this phase, it's different for every single person who walks through our door. For some patients, phase 3 means being able to reach up into the cabinet and grab a cup without wincing. Being able to maybe mop, sweep, mow the yard, shower, get dressed without having to plan your every movement. Drive to work again. For me personally, phase 3 after my back flare-up meant one specific thing, getting back on the bike, the bicycle. Now, I should tell you that the bike I ride is not a typical upright bike. It's an aggressive bent forward road bike, the kind where you're bent forward at the waist for long periods of time, which honestly is pretty horrible. It's terrible for your body mechanics and your back, but it's one of the things I love the most. So, phase 3 for me was working towards that. Not just feeling okay, but being able to do some things, the thing that really matters the most to me at that moment. So the goal of phase 3 is not a generic recovery. It's a personal one, and that's what we help you design here at Moss Rehabilitation Center. So your physical therapist in this phase is acting as your coach. They're watching how you move. They're identifying what's still off, what are the movement patterns that aren't just right, and working to progressively load your body in ways that are specific to your goals. And they're holding you accountable, which matters more than people actually realize. Think about it this way. If you're trying to manage your blood sugar, say you're diabetic, you wouldn't just guess and hope for the best, would you? No, you would test it, you would check it regularly. Okay, you would talk to your doctor, your nutritionist, maybe your pharmacist about adjustments that you can make. Okay, you'd have someone in your corner keeping you honest and accountable, holding you accountable to what you were doing and eating. Recovery is the same. Without accountability, it becomes very easy to not push yourself and to not get the results that you're actually capable of. Here's what I want you to hear right now, and I want you to really hear it. Most people quit in phase 3. They're feeling good. Pain is near zero. Strength and mobility have improved. They're making real progress. And they assume, incorrectly, that the body will just keep on getting better on its own. So they stop exercising. They stop coming into therapy. And slowly, quietly, they start to regress. The regression is small at first. A little stiffness here, a little more fatigue here, and then one day they're back in the clinic and we're starting all over. So you have worked so hard to get to this point. Please don't quit. quit. Keep pushing forward. I'll tell you something I say to patients all the time, and it's a quote. A healthy man has 1,000 wishes. A sick person, only one. When you have your health, you take it for granted. When you lose it, you'd give anything to have it back. So push a little further. Phase 4 is right there. So phase 4 is about one thing, making sure you never have to go back to phase 1. So the phase is built on building strength and endurance to help prevent future problems, and on building healthy habits that will help you benefit for years to come. So here's something worth knowing. After the age of 30, we start to lose about 1% of our muscle mass. It's called sarcopenia, fancy word. Our tissues get stiffer. Our recovery time is longer. And that's not a scare tactic, it's just your physiology and your biology. Okay? But here's the good news. It's not inevitable. If we stay active, if we do some simple exercises 2 or 3 times a week, we maintain some strength, we maintain some flexibility, we can dramatically slow that progress and stay strong and mobile well into our later years. Phase 4 doesn't mean you need to do intense CrossFit workouts or some kind of crazy boot camp. Okay? It's not that. It's simpler than that. It's showing up for your body consistently. That's the key. Consistency is the key. So at this point, if you're coming to us, phase 4, you're still coming in for some sessions with your therapist, but it's much less frequent. Okay, think of them as little mini tune-ups for your body. Okay, so we've had many patients over the years that they've come back in a few months, not necessarily in a crisis, but just a little bit off track. And honestly, it usually doesn't take much to help get them progressing again. A few sessions, some adjustments to their program, and they're back on course. Prevention is always easier and less expensive than repair. Think about it. Phase 4 is also where we also get to start setting you up for the most exciting phase of all, which is what we're going to cover in part 3. So let's bring it back together. Phase 3 helps you return to the life that you care about. Phase 4 makes sure it sticks. In part 3 of this series, the final video, we're going to talk about something that most people never expect to hear from a physical therapist. High performance health. Phase 5, performance enhancement. Okay, not just surviving, but thriving. And I promise you, it's not just for athletes. So if you haven't yet downloaded the report in the description, it covers all 5 phases in detail and gives you something you can actually hold onto and refer back to throughout your recovery process. And if you're watching this thinking, oh man, I just quit too soon, or I keep dealing with the same thing over and over again, then schedule one of our free discovery visits with one of our doctors of physical therapy or occupational therapy. They will go through, they'll figure out exactly what phase you're in and how we can actually help and build a plan for you. No pressure, no obligation, just real answers. So the link is in the description below, and I'll see you in part 3. I'm Dr. Robert Moss, and my job is simple. High performance health for people who refuse to sit on the sidelines. If you're ready to stop managing pain and start living without it, click the link below. Move well, live well. See you in the next one. Thanks.